Yes, ma'am.
Yes, ma'am. I'm Miss Marlene from Bridgestock. Ma'am, ask ko lang po, is the vape are the register from the Food and Drug? It is the license, but registered in the Department of Trade and Industry, right?
Yes, our law has shifted from FDA to DTI, so it makes a different what is that sense? Statement na it's a consumer product. Yung liver spread meron sa FDA, yung pang vape nandoon sa DTI. Kasi ang mahirap kasi, there is a device to be regulated and there's the e-liquid. The law actually nakalagay doon with consultation with FDA because of the e-liquid. So there is actually a catch. So and then there should be graphic health warnings in the kaso pinagbibili yan, wala naman yung pack. So they get it, wala. Para ring cigarette sticks eh. Yung cigarette sticks kaya may graphic health warning, tapos as bigger as better. Canada has implemented putting the graphic health warning na dun sa sticks eh, para makita. Sa atin, tingi-tingi, hindi nakikita. And sad to say, we have cigarette packs, kiddie packs, no? From 12 naging 6. Kasi mahal eh. Ginawang maliit, so mas affordable. So merong flaw, but there are actually good points pa rin kasi dapat kasi nga yung 100 meters. Restriction of nicotine is actually controversial because our nicotine is high. UK is just 40 milligrams. I really don't know. I've been questioning DTI. Where did you get that level, the 65 milligrams? Because it's going to harm even an adult who's going to ingest that.
Yes, ma'am. I have two questions pa. Ma'am, what are the position of the Department of Health regarding the use of e-cigarette and vapes?
Ma'am, before 2 weeks ago, mayroon ng sinabi na vape is harmful. You have to say no to smoking and vaping by our DOH. The campaign is there, but the implementation and the reach should be
The
there.
implementation.
Oo.
We don't hear too much about that, the campaign.
Opo.
Hindi masyado sana
Di kagaya ng Yossi Kadiri, no?
Right. Isama nila sa mainstream media like yung free TV with that kind of advertisement.
Kailangan pa more education, more drum roll.
Yes.
Last questions. What can consumer, parents, and educators to do protect young people from being targeted by the tobacco industry?
You should know the product themselves. Because you cannot teach if you don't know the harms of the tobacco. So definition of terms, cigarette, electronic smoking devices. Electronic smoking devices, that's vapes, and the heated tobacco product. Simply stated, they are all bisyo, they are all harmful. You should not say, oh, this is least harmful. Wala pong ganong dapat definition. Wala dapat bisyo. You know what? I'm telling them, this advocacy is meant for our children. We're promoting clean air. We can never have clean air if there are smokers, vapors, and heated tobacco products. Second, the number one leader is actually the cigarette butt. Now we have vapes, we have heated tobacco products. There will be more disposable single-use plastics. There will be more batteries. There will be more chemicals leaching. Wala tayong provision for that. Yung ang sa news, 60 million worth of vapes confiscated. Ang question ko na, paano kaya dinispose?
Yeah.
In Baguio,
Yeah.
in broad media, tinitignan nila, tinatanggal yung battery, tinatanggal ganyan. So, ito hindi ko alam anong ginawa dun sa 60 million vapes na illicit.
Ay,
diba?
hindi naman pwedeng ilaglag lang sa bangin or sa somewhere.
Oo, or recycled. I don't know.
Recycled.
Illicit.
Right.
And siguro po to add lang also to this, no? Napaka-susceptible ng ating mga kabataan ngayon to direct marketing talaga. Right now, napaka-importante yung role pa rin of the parents, of course, of the educators, of our community-based workers, even our LGUs, of course. But the children have access. So they have access both online and offline. So I think it's high time that when we do campaigning, we also need to direct it to the children. As early as maybe 12 to 15, they need to understand these things already. Because may build up po yan eh. You're trying to shape the behavior of people as early as 10, 12, 15 years old. So doon nila natututuhan ng mga bagay-bagay. You need to make sure that at that early age, you can be able to inculcate already in their minds na mali ito, bawal ito, the industry is doing all of this to you, and you need to take action. You really have to make a statement na hindi dapat kasama ang kabataan. And a lot of young leaders, young as they are, and a lot of our youth leaders are doing all of these efforts already in the community. Siguro kailangan lang po na we get to collaborate more closely with, the medical professionals like you, ma'am, the many different organizations doing this. Kasi ang boses sa mga kabataan will also ensure na yung sustainability ng efforts natin, we can start doon mismo sa foundational stage nila, at hopefully we can be able to stop the epidemic from happening decades from now. Yes po.
Collaborating with the Department of Education, so we start in the children. But for pediatricians, we have this anticipatory guidance. Pag nanganak, wala po dapat sigarilyo and vape because of the secondhand aerosol. Pag nandoon sa school, dapat yung transport provider walang nagsisigarilyo kasi yan po pag sumakay, sigurado bababa ang resistensya. At pag nasa school, dapat tignan lahat ng bata na walang mga ganyan, yung mga devices, and instill healthy habits talaga. So at pag nagkaroon na talaga ng bisyo, dapat meron ng support from the teachers, refer to the pediatricians or to the cessation specialists. We can do if we always interconnect with each other. Information is the key.
Yes, sir.
Yes, good afternoon, everyone. I'm Pili from Buhay Marino Diario. We cater to seafarers, one of the group who smokes a lot.
Yes, seafarers, mga seaman.
Apo.
Yan ang kanilang pangalis ng stress kuno.
Yes.
Ganyan.
However, ang tanong ko po kasi, at this point in time, what is your opinion regarding the status of the sin tax? There are only two things kasi to stop us from smoking. Number one is to inculcate fear. I myself started smoking at the age of 12, and I'm now 71. In cold turkey, I stopped smoking during the start of the COVID, because of the fear. When I buy cigarettes and retails, the salesman will hold out the stick, and then I can be transmitted with COVID. And then the other factor, just like as you're saying, sir, yung packaging. Because yung packaging ng sigarilyo, it's already very fearful. So yun din ang dapat gawin sa vaping. Now, the other policies po, kagaya ng binanggit kanina, which is also somewhat na nagtataka kami sa industry. Bakit ang nagre-regulate is DTI? Siya, instead of DOH and other related agencies, which is ironically, mas nakakatakot kasi DTI concerns with commercial consumer products. So instead na regulate yun, nadidefeat yung purpose of keeping us healthy. Isn't it?
Yes.
Ito yung mga issues na But number one sana po, taasan nyo ang presyo, make it not affordable, then regulate yung i-increase yung tax. But there is now, in the Congress yata or in the Senate, to retain the tax in the next 6 years, which is the sin tax, which is dapat we go against it. Kasi unang-una mawawala na ng kita ang gobyerno in terms of revenue. Pangalawa, bababa ang presyo. So mas
Sir, we
madali
were
na bilhin.
able to curb that appeal
Opo, we should do an appeal
Yes,
on that. On the same
Senator
tax
Win Gatchalian was able to curb that appeal of lowering the taxes, the price of the cigarettes, because of the proliferation of the illicit cigarettes. It has to be sustained. We have to call that. Now, DTI, honestly, I don't know how it came into being kasi po, up to the last moment na magpapalit ang presidente, we were pushing for that law, 21 years old, tapos restriction of flavors, higher tax, but it lapsed into law when the governance was actually nagpalit. It's actually a complicated thing. Pero po, the Philippines is part of the Framework Convention on Tobacco Control, the FCTC, wherein we implement the 6 strategies: monitoring, protecting, no? So that's actually the graphic health warnings and the regulation, warning, and then raising the taxes. That's actually the most effective, especially for children. The higher it goes, the more it's unacceptable. Yun po. And that is actually being used also to regulate vape, as dictated by the WHO. We are in there, but you know what? The process is so small. So the health advocates should really be saying our views, our clamor, that we have to implement this. And I think you, the media, can help us to drum that campaign. Thank you, sir.
Thank you po.
Thank you. Oo, I agree with that. Doktora, siguro it's better that the amount of that vapes or the will increase para hindi ma-afford ng mga bata, lalo na yung mga ages 13 to 15, so they cannot afford to buy. Yes, right. I have a question for Von. Are you getting any support from the policymakers or civil society in your campaign against this vaping and e-cigarette?
Right now po kasi, we're still at the initial stages of developing the campaign. So it will launch by June. But in terms of the CSOs, very strong naman po ang support on ground talaga. And even, our medical society. So we really collaborate with them closely in order to make sure na, number one, we get the science right. Kasi kailangan maintindihan natin yung siyensya behind all of these. And at the same time, we come in to make them more accessible through communication. But then you need the grassroots intervention through your CSOs in order to reach the right audiences and those who are vulnerable within these communities. No? In terms of support of policymakers, it really depends po kasi on the LGU. At the end of the day, what we would do kasi is I would say it's more grassroots anchored. So it would be very dependent in terms of the priorities also of the LGU. If this is something that they see as one of the main important things that need to be addressed, then we get strong support. No, but again, that's where the lobbying comes in. That's where yung ground activation comes in. Kasi sometimes the pressure also helps. No, so they need to hear the voices of our children, of our young people, and even the enablers like the parents, the educators, for them to prioritize these things. So it's really a delicate balance, I would say. But given naman, to be honest, when we were reviewing the regulations in the Philippines, I would say it's still pretty much comprehensive po. We have a lot of regulations, but I think kaya I'm emphasizing the intervention of LGUs and making sure that we work also with grassroots organizations. Kasi yung problema, tama yung sinabi ni Doc, no? It's on the implementation. And we just need to make sure that the end-to-end process is really robust for us to address this issue.
One of the factors kung bakit siguro hindi nahirapan din i-hold yan because of the lobbyists, right? Malaking pera yan. That's a big industry. Malaking billions of dollars ang involved yan. And hindi naman sa pero some politicians medyo merong something para hindi ma-approve or ma-push yung mga moves or to fight this kind of addiction, right?
Actually po, so I'm also currently doing like a side research on this po, Doc, specifically to when it comes to the communication framing and narrative building. A lot of these also kasi are being hidden from like a CSR quote na parang you talk about, the industry wants to talk about the public health narrative from their own lens. And that's actually reflected not only in terms of, you know, the communications that they put out, but in terms of the many CSR initiatives that they're doing. So medyo marami po din silang binuboost na resources talaga in terms of making it subtle, but at the same time, very heavily embedded in the communities.
Yeah, I may plug tomorrow World No Tobacco Day, May 31, and this year's theme is unmasking the appeal. That is to protect our children, and we have told you the appeal, the harms. So I appeal to you to drum roll this in all your write-ups. You're doing this for the children, the future of our land.
Okay. I have another question for Dr. Agler. People say, or the smokers say, I will quit na, or I will lessen the amount of the cigarettes that I will take. Will this be really effective? Mayroon bang mabuting magagawa if they just lower the number of like for today, normally I finish 1 pack, but for today I will just take 10 sticks. Mabuti ba yun o wala rin?
In the with reference to the lung health po, no amount of smoke will be will prevent will be good for the lungs. So it's really stopping for you to be able to protect your lungs.
Oh, thank you.
Yes, good
So,
morning.
just another question from the floor. Go
Yes,
ahead.
I'm Salvi Requirme from Ronda Balita. Para po kay Doktora, i-ask ko lang po kung, halimbawa, Doktora, kasi ang vape, anywhere mayroon pong nagvi-vape. Ask ko lang po, ano pong epekto mas lalo na po doon sa mga kabataan? Even me, I'm not smoking. Pero minsan pag nagvi-vape, hindi maiwasan na pag nag-blow sila, kasi di ba ang laking usok, yung mga hindi nagvi-vape, pag naka-inhale ng usok ng vape, may possibility po ba na magkaroon din kami ng effective, mas lalo na po sa kabataan kasi anywhere. Hindi lang pumalit na blow ang smoke na ginagawa, pang malaki yan. So marami pong nakaka-inhale. So ano po yung possibility at ano po yung dapat natin gawin para mo maiwasan po sana yan kasi kami, I'm taking of myself. But the problem yung katabi mo, hindi siya nag-iingat. Blow siya ng blow ng smoke ng vape. What we can do?
Secondhand
Thank you po.
aerosol
Yan lang po.
is real, okay? And I hope the regulation will be like that of tobacco. There should be designated vaping areas, no? Meron naman, no? So wala dapat sa mga government. Kaso makikita mo na sa stairwell, nandun sa parking area, it is covered. Hindi dapat, no? So I think, no, the bad thing is yung education kasi akala nila user lang. But the bystander and the environment in itself are actually affected. So dapat talaga awareness of the harms of all these products are the same. Sabi mong minimal. Laging sinasabi ko, kasi cancer agents, di mo naman pwede i-quantify. So, kumain ka ng tosino from ganyan, mas maraming salitre. Kumain ako ng tosino na ganito. But they are still carcinogens. You don't know when your body will react to form the cancer or even diseases. So, dapat no, zero. So, we hope that there should be, yung tobacco natin kasi yung EO26, di ba, no smoking in public places. So, ang daming violation pa rin. Sana implement. Dapat yung vape din, no vaping in public places. Happy na ako pag ganun eh.
Yes, sana nga. Sana nga. Yes, sir.
Erlo Bringas po from Net25. My question is for Doc Gonzalez and Doc Sophie can also answer. Okay, do you think that education department should also do a like mitigation or initiative to educate the children that there is a harmful effect of the this tobacco heated products?
We've been collaborating with our Department of Education since 2017. They have the tobacco control, what is that, program among the teachers. Kaso medyo slow ang rollout. I really don't know. We in Southern Tagalog has actually collaborated with our teachers so that our lay fora will be incorporated into the science class. Hindi lang vaping, hindi lang smoking, pati alcohol. Gusto namin na i-ano. So it's actually the teachers, no? So slow, but we're doing baby steps rather than, dati na yan. At least baby steps and we have to convince. So itong Brigada Eskwela, I'm proud to say, our Southern Tagalog are actually collaborating with our school to continue doing this and implement them in their science classes.
Follow up for Doc. Okay, Doc Sophie.
Oh, I would only add that it is really important. They are the group that are most vulnerable, and obviously most targeted by the industry. So, we need to make sure we protect them. And so integrating into education is super important. But we need to remember as well that children are often the most open-minded. And so the earlier that we can talk to them and give them critical thinking skills so that they can truly assess these things for themselves, the better they will be protected from the tactics of the industry.
Follow up po, last question yan. Alright, Doc Gonzales, do you think po na we need to amend the current law about the use of tobacco? Kasi ngayon po kasi it focus only to tobacco lang. Yung vape kasi parang
The vape
nito lang
law,
siya.
we start with the vape law. No? So we were actually successful in raising the age of access to 21. That's actually after the tobacco 21 project of US. Kasi nga, the brain is still developing, they're susceptible to nicotine and lesser flavor. But during the pandemic, it was reversed, no? So actually, we have legislators now who's going to push the age to 21, bring back the regulation to FDA, restriction of flavors, even to ganyan. So we're hoping. Actually, yung isang legislator kanina, sabi ko, Sir Ma'am, tulungan mo kami. And I hope we will be successful.
Okay,
Thank
thank
you
you.
po. Thank you.
We're almost out of time. So maybe I'll ask the last questions to Sophie here. So what should policymakers in the Philippines watch out for as the HTP and vaping addiction industry is being pushed in our country right now. So there's alarming increase in numbers of users. So what should you suggest to our policymakers?
Thank you. So I mentioned earlier that we need to make sure we keep an eye out for conclusive statements that just aren't supported by the evidence or are only supported by questionable evidence from the industry. But what they need to look out for, again, is when they're seeing these arguments of less harmful or safer, is to not just think on an individual level. Policymakers protect citizens and a society as a whole. And so we need to make sure that we're considering all of those in the society when we're looking at tobacco and nicotine products. And so when looking at ones that could possibly help smokers, it's about making sure that they then don't impact youth. And so to always remember to think about youth and non-smokers when they're considering these products, not only smokers. And the other thing, of course, is to look for credible science, which is hard. It's very hard because the tobacco industry hides its funding. Right? They will secretly pay scientists and secretly pay experts to conduct research so that it looks independent. So I appreciate that's very, very hard to do, but it's still important that we try. So making sure that they're aware of where the evidence comes from, that they're basing their policies on, and also setting a standard for evidence. Don't just accept, toxicology studies, so just testing the aerosol. Just because a product exposes you to lower levels of chemicals, you already touched on this, if it's still exposing you to some, the risk may not decrease. Any number of exposure to carcinogens could still cause cancer. And so we really need to make sure we're carefully considering the evidence.
Thank you. Thank you. Dr. Gonzalez, what specific actions would you recommend to our government to take control of this vaping epidemic?
Number one, no matter how flawed that vape law, let's implement it and then amend it again to raise the age, restrict the flavors, and then we would like to create a safe environment for our children that is actually smoke and aerosol free environment, no? So walang smoke free lang, kailangan aerosol. And then since even WHO, our own DOH, is always saying that air pollution is a risk factor for stroke, for hypertension, for numerous communicable diseases. So having a tobacco and nicotine free, we will lessen that air pollution. And definitely, the health funds we need, no? Kasi diba, number one ang smoking as a risk factor for the top NCDs and number one for infectious diseases. Bababa yun. So yung health burden ng Filipinos, bababa if we are really will be implementing our tobacco and nicotine laws in place. So, yung nasa laylayan, yung research ni ma'am, yan jeepney and all, hindi yan nakakarinig sa TV, pero sila yung most affected. Pag sinabi yan ng doktor na itigil mo yan para hindi ka magkasakit ng mas malala o ikamatay mo, educating them is actually vital. And I think the lawmakers has to realize that we need to reach the laylayan and craft laws which can reach our laylayan and underprivileged kasi they're the most affected.
Thank you, Doctora. Doctora Claire, what can the community or the healthcare providers, what can local communities play in supporting smokers who really want to quit from smoking, even the vaping?
So as I've said before, most of these smokers are actually willing to quit, but they need support with their quitting. So which is why the quit lines the working quit lines would probably help them, and communities and LGUs who have trained counselors for quitting could help a lot. So as Doctora has said, the health burden would really decrease if we decrease these lifestyle issues that could impact on the health of our people.
Okay, thank you. And Vaughn, being a representative of the young people here, what can young people do to take back their future from an industry that is trying to addict them to nicotine, vaping, in new ways?
Napakasimple lang po, no? So they can begin with using their platforms. So napaka-accessible ngayon ng social media, no? You know how to navigate Facebook, Instagram, TikTok. Start from there. It's as simple as just posting something that, you are against this. You are against the products, you are against the industry manipulation and deception. And at the same time, ito yung stance mo when it comes to this. You can even play around with it. Pwede siyang maging fun din, no? While doing this advocacy, young as we are, we can be able to dance on TikTok and still promote this awareness, no? Yung awareness about tobacco products use, no? Marami ring mga organizations ang ating mga kabataan. We have our student councils in schools, no? We have our YesOs. We have a lot of youth-led organizations. Marami silang ginagawa on ground at pwede itong masama doon, no? In all of our science-led projects, pwede itong kasama sa mga gagawin natin, makakapagsimula tayo in our schools, in our barangays, and of course, with the help of our SKs as well, with the help of our, even yung mga kabataan natin who are working with the church, no? Marami tayong outlets. But I guess, yung pinakasimpleng pwedeng gawin talaga is just to begin with making it an everyday habit doon sa mga ginagamit nating social media accounts. No? Kasi pag marami tayong nagsasalita, no, a lot of us are saying na, you know, it's enough and we are taking back our future as young people. Lahat-lahat ng yan, our collective voice, that's a big force already for us advocates, no, to go against something that's really big, something that's quite impossible. No, kayang-kaya nating gawin ito when we collectively do it together.
Okay, thank you. And we really are running out of time. So, final words from Dr. Gonzalez, please.
Let's create clean air. Let's promote a tobacco and nicotine-free world because we want our children, their future, to inherit a healthier world. Not, ang dami nating problema. COVID is actually on the rise. So many communicable diseases, even water, no? So let's start from number one, air. Clean air, we can only achieve that if we don't have any cigarette, vape, aerosol. So this is actually what's actually our mantra. Clean air for children. Less waste for our children. They deserve to inherit a better world.
Thank you. Dr. Rizalina Gonzalez. Yes, Sophie, Doctora?
Thank you. I would say to young people and to youth, don't be a lab rat or a guinea pig for the tobacco industry's products that are addictive and have unknown harms. You know, don't let them take away your free choice and your free will, and don't line the pockets of companies that are already making billions of dollars and are actively harming public health and the environment.
Okay, thank you. And Dr. Aguilera, final words, please. Okay, so that ends up our forum for today, agenda. And I hope you parents, please watch out your children. Tignan po natin mabuti kung ano yung mga binibili ng ating mga anak sa online, and kung ano pa yung what are the other things that they're involved with, or mga this kind of ano ba tawag mo dyan, bad habit or addiction. Please watch out, check on our kids, at their future is at stake. So be very careful. And children, please listen to your parents. Listen, that this is not really good for you. Para sa kabutihan ninyo ito, para sa future ninyo ito. So, tigilan na natin yung vape, smoking, o e-cigarette, whatever. Basta masama sa ating kalusugan. Thank you all so much for joining us today. And thank you, Dr. Gonzalez, Dr. Sophie, Dr. Aguilera, and of course, Pon. Maraming salamat and have a nice day. Thank you.
Thank you so much.